Coming to the do's and don'ts with braces treatment or aligner treatment, with braces, you have no choice. The braces are bonded onto your teeth and they're gonna be in that position until your treatment is completely over. And that is about a year minimum to maybe 2.5 to 3 years sometimes. Coming to aligners, because they're invisible, because you can remove them, the advantage is the fact that you can eat whatever you want. You basically remove the aligner, eat whatever you want, drink whatever you want, just rinse your mouth before putting the aligners back on, and you're good to go. But a lot of patients have forgotten their aligners at restaurants. They've removed it, put it in their box, put it in their pocket. They've forgotten to put the aligners back on. So patient compliance becomes a major factor. Coming to the do's and don'ts with braces treatment or aligner treatment, with braces, you have no choice. The braces are bonded onto your teeth and they're gonna be in that position until your treatment is completely over. And that is about a year minimum to maybe 2.5 to 3 years sometimes. So you have no choice but to brush with the braces on, eat with your braces on, sleep with your braces on, attend your work meetings, functions, everything with your braces on. Coming to the don'ts, you can't eat very hard food, very fibrous, very crunchy food. We ask the meat eaters to cut down on the bone. So you'll get the idea once you start using the braces. And even the brushing technique is different. It changes compared to how you usually used to brush to how you brush with the braces on. And twice a day brushing is mandatory whether you're going through braces treatment or not. But with braces, it's even more important. We do request you to start using interdental brushes, water picks, etc. And coming to not eating, you can't have chewing gum, you can't be opening bottle caps, you can't be opening packets with your braces on because everything is going to be wanting to break the brace in the first place. And once the brace is broken off from a certain tooth, even if it is just one brace among all of your upper or all of your lower, what usually tends to happen is the entire wire just gets a little passive. So whatever force that we have applied in that particular appointment, until you come back to us and we rebond that particular brace to the tooth and we retighten the wire, your treatment is just laying passive in your mouth. So you're basically losing a whole month's worth treatment. So those are the disadvantages and the do's and don'ts for braces. Coming to aligners, because they're invisible, because you can remove them, the advantage is the fact that you can eat whatever you want. You basically remove the aligner, eat whatever you want, drink whatever you want, just rinse your mouth before putting the aligners back on, and you're good to go. But coming to the disadvantages of aligners, a lot of patients have forgotten their aligners at restaurants. They've removed it, put it in their box, put it in their pocket. They've forgotten to put the aligners back on. So patient compliance becomes a major factor. Adult patients, because you all want to finish your treatments fast, you do tend to remember better. But kids, especially the school-going kids, unless they are really interested, aligner treatment could actually be a longer treatment than braces could, because with braces you're bringing the child once a month and I'm retightening it, reactivating it, and we're done. But with aligners, if the child decides to put it aside because she has exams, then the treatment halts there until she or he starts again. Coming to disadvantages, you have to remove the aligner before eating. There is no other option. If you think it's a little not so convenient to go and remove your aligner before you drink anything, before you eat anything, especially the ones who drink coffees and teas a lot, the ones who smoke, the ones who drink alcohol every day, you can't do any of that with the aligner in your mouth. So because the aligners are transparent, they're going to want to take up the color from your food. So tea, coffee can stain your teeth, green tea stains your teeth, black coffee stains your teeth, cigarette smoking stains your teeth. So when you wear the aligners and try to do all of these things, your aligner is staining as well. And you have to wear the aligner for a 14-day period. So anytime in this first 7 to 8 days you discolor it, or you happen to have juice with the aligner on, or you happen to have aerated drinks with the aligner on, you happen to have something outside which has added color in the food with the aligner on, and that's it, your aligner is discoloring as well, and you have to maintain that aligner until the 14th day. You have no choice. So once your 14 days is done, you're anyway switching to the next aligner, so this can be discarded, but that's the only disadvantage. For a lot of patients, I think out of 10, let's say 2 patients have complained about speech problems as soon as we deliver the aligner. But this speech is something that they catch up with within a day or two of the aligner wear. It's just that there's a feeling of something new in your mouth, and your teeth don't really touch each other anymore because there's an aligner covering your upper teeth and there's an aligner covering your lower teeth. So it's usually aligner to aligner contact, which makes a lot of patients feel that their teeth have come forward, or their mouth looks like it's moved forward. But other than that, there's no other disadvantage.